Hey guys, so I am back again. I know I've kind of been like switching around the days I'm posting stuff on, but things have been a little bit crazy. Just getting used to going back to clinicals. This was actually my first week back at clinical, and today's my first day off. It's Saturday. So that explains why I didn't have a video out on Friday, just because I had 12-hour days, and when I would get home I would just need to, do other things I hadn't had time to do throughout the day because I was at clinical. So I just want to talk to you guys a little bit about my first week. It went by really fast. I'm actually at 2 sites this time, so it makes it go by even faster. I got to see a lot of new stuff, which is great. I got a lot more experience with trach care, things like that, and I think that getting back into the groove of clinical can take a little bit because you go to a new place, you're not really sure where anything is, you don't really know any of your preceptors yet, so you're not sure how each person likes things done, because you can go from one preceptor that likes certain things a very specific way and then go to a preceptor the next day who wants things done completely different, or is okay with you doing certain things and maybe the other isn't. So that kind of takes a little while to feel everybody out and see what they're okay with allowing you to do and not to do, because ultimately you are working kind of, you're working under their license. They're responsible for you for that day. So some people are a little more strict than others, or more willing or less willing to let you do certain things. And that's completely understandable. It's up to each person, because again, they're responsible for you for that day. So you kind of have to just go with the flow and see what they prefer and what they will allow. And something else I just wanted to bring up, clinical is always a learning experience. And even if you took a test on something and felt really comfortable with it, doing it in the real world is a whole nother thing. So you might feel a little out of sorts, or maybe even kind of dumb occasionally, because you can either confuse what someone has asked you, or maybe you get a little bit nervous so you forget the answer to that question in a split second, and these things happen. If you have a good preceptor, they totally understand. Everybody was in your shoes at one point or another. I got really lucky and had some really good preceptors. I had a different person each day because I was at one site one day and then another one the other day, and then somebody was off. So I got to meet a lot of really nice RTs, which is really cool. It was just really interesting also seeing how each of the RTs explain things differently to family members in the rooms, or how they explain pieces of equipment. Just getting to see how each person goes throughout their day. You can kind of pick up tips and habits that might make things easier throughout your day. And then also, it was kind of funny because there were certain things I had done at my last clinical site that are done completely different at another place, because of course they're 2 different places. So it was kind of weird feeling like I was used to doing something and then having it done completely different. So for example, like a transport may not be done the same way at every location, whether it's the RT that goes and gets the oxygen, or if you're using a vent, or if you're bagging, or if the transporter brings the oxygen. All of these things can be different depending on where you're going. So it was kind of funny to relearn little things like that I had learned at my previous site, because it was done just completely different. So keep in mind, even if you feel comfortable with something, there might be little things that that kind of make you almost feel like you've never done it before again, or even just things like different equipment, different types of syringes or machines or vents or BiPAPs, whatever. They're all a little bit different, so you might end up fumbling around with them a little bit before you kind of get your feel for it and get used to using those things. But basically that was it. So that's just kind of like my first week. Normally, again, I have 3 12-hour days per week and then a 4-hour lab. Usually what we do is, of course, we have our timesheets where we have to sign in and out. And then we also have something called physician contact points, meaning if we assist with certain procedures or watch certain procedures and talk to the physician about it, then we have to write it down and have our preceptor sign that it was something that we did. So we get points for those. So for example, if I am involved in physician rounds, if I actually am able to follow the residents and doctors around and listen to them talk about patients, if it's so many hours, I get like 3 points. If it's the full rounds, you know, like 6 hours of rounding, then I get 8 points, something like that. And then if it's just communicating with like results to a patient's physician, I get 1 point. I think it's just to kind of get you used to talking to physicians and communicating in a professional manner. And it is good practice because, you know, growing up, you always watch TV and you always hear people talking about physicians and what it's like to communicate with them, and they kind of put physicians up on a pedestal, so it can be intimidating for a student just coming out, you know, not feeling like they absolutely know everything yet, to go talk with a physician and communicate results or talk about a patient's status. So I actually like that a lot. It kind of pushes you to do those things that might, you know, otherwise, if you're nervous, you might not actually do. Something we did do before also, we had competencies last semester where there were certain tasks that we needed to get done so many times, like, for example, 5 successful ABGs and PEP therapy, CBT, I think IPPB was one last semester. So we usually have things like that that we have to sign off, or have, you know, our preceptor for that day sign off saying we completed successfully. Or if they don't have that device, like a lot of areas here don't use the IPPBs anymore. For that, I, you know, talked to my clinical instructor about it, and we had one at the school that they let us put together and kind of mess with, things like that. And then also we have to write chart reviews to improve our diagnostic skills, to see what kind of values are going to go along with different processes. And at the end of the semester, and at the end of my clinical rotation, which is the end of my semester, I'll have to create a PowerPoint presentation and present whichever chart review I decided that I turned in throughout my clinicals to present to my classmates, usually other classes, the instructors, things like that. Which is also good practice because sometimes you will find yourself in a room full of people having to discuss your patient. So it's just another way to prepare us to go out there into the real world and kind of, you know, get used to communicating professionally, I guess. So basically that's it. It was a pretty quick week. Sorry, it's my first day off and I slept a ton. I could not wake up. I would wake up for half a second and go, oh no, just 5 more minutes, I've got today off, and then nope, just kept sleeping. I guess I needed it though, so sometimes you just have to listen to your body and do what it needs. If you feel like you need the sleep, take that extra hour or so and sleep and let your body recover, because it is difficult to start going back to clinical. It's very physically demanding as well as mentally demanding. There's a lot of changes and a lot of things happening all at once, so you kind of have to let your body recover from that when you can. Alright guys, so if you have any questions, definitely leave them in the comments down below, and let me know how your guys' clinicals are going, if you're on them right now, or if you have any questions about clinical in general. And I will try to keep these updated semi-regularly. I might have to move to the weekends just while I'm on clinical, but I guess that's it. And I will talk to you guys later.